Welcome. Today we're diving into the world of antibiotics and antivirals. These two types of medications are often mentioned when we talk about fighting infections, but they work in very different ways. Understanding the difference can help you know why your doctor prescribes one over the other. In this video, we'll break down what antibiotics and antivirals are, how they work, and why using the right one is so important for your health. Let's start by looking at what infections are and why we need special medicines to treat them. Infections happen when harmful microorganisms like bacteria or viruses invade our bodies. These invaders can make us sick in many different ways, from a simple cold to more serious illnesses. Not all infections are the same, and that's why different treatments are needed. Some infections are caused by bacteria, while others are caused by viruses. Knowing the difference is the first step in understanding why antibiotics and antivirals are used. Bacterial infections are caused by bacteria, which are tiny living organisms. Some bacteria are harmless or even helpful, but others can cause diseases like strep throat, urinary tract infections, or pneumonia. When harmful bacteria multiply in the body, they can make us feel very sick. That's where antibiotics come in. They're designed to target and kill these bacteria, helping us recover from the infection. Viral infections, on the other hand, are caused by viruses. Viruses are much smaller than bacteria and can't survive or reproduce on their own. They need to invade our cells to multiply. Common viral infections include the flu, common cold, and COVID-19. Because viruses work differently from bacteria, they need a different kind of medicine to fight them. That's where antivirals come in. Antibiotics are medicines specifically designed to kill or stop the growth of bacteria. They don't work against viruses, which is a common misconception. There are many types of antibiotics, and each one targets different kinds of bacteria. Doctors choose the right antibiotic based on the infection you have. Taking antibiotics when you don't need them can lead to problems, which we'll discuss later. Antibiotics work by attacking the bacteria in your body. Some antibiotics kill bacteria directly, while others stop them from multiplying so your immune system can finish the job. It's important to take the full course of antibiotics as prescribed, even if you start feeling better. Stopping early can allow some bacteria to survive and become resistant to the medicine. Antivirals are medicines made to fight viruses. Unlike antibiotics, they don't kill the virus outright. Instead, antivirals work by stopping the virus from multiplying inside your body. This helps your immune system get ahead and control the infection. Antivirals are used for illnesses like the flu, HIV, and herpes. Each antiviral is designed for specific viruses. Antivirals don't destroy viruses directly. Instead, they block the virus's ability to reproduce or enter healthy cells. This slows down the infection and gives your body's immune system a better chance to fight back. Some antivirals are used to prevent infection, while others help reduce symptoms and shorten the length of illness. Main difference between antibiotics and antivirals is what they target. Antibiotics are only effective against bacteria, while antivirals are designed to fight viruses. Using the wrong medicine won't help and can sometimes make things worse. That's why it's important to know what kind of infection you have before starting treatment. Many people think antibiotics can cure any infection, but that's not true. Antibiotics have no effect on viruses. Taking them for a viral infection like the common cold won't help you get better and can actually cause harm. Overuse of antibiotics can lead to antibiotic resistance, making it harder to treat bacterial infections in the future. Just like antibiotics don't work on viruses, antivirals don't work on bacteria. If you have a bacterial infection, taking antivirals won't help you recover. That's why doctors carefully diagnose your illness before prescribing medication. Using the right medicine for the right infection is key to getting better quickly and safely. Some common antibiotics include penicillin, amoxicillin, and azithromycin. These medicines are used to treat a variety of bacterial infections, from ear infections to pneumonia. Each antibiotic works a little differently, and your doctor will choose the best one based on your specific illness and medical history. Common antivirals include oseltamivir for the flu, acyclovir for herpes, and antiretroviral drugs for HIV. These medicines are carefully designed to target specific viruses. Not all viral infections have effective antiviral treatments, so sometimes your body's immune system is the main defense. Doctors use your symptoms, medical history, and sometimes lab tests to figure out if your infection is bacterial or viral. This helps them choose the right medicine. Sometimes they may wait and see if your body can fight off the infection on its own, especially if it's likely to be viral. One of the biggest problems with antibiotics is resistance. When bacteria are exposed to antibiotics too often, they can change and become resistant. This means the medicine no longer works, making infections harder to treat. That's why it's so important to use antibiotics only when necessary and always as prescribed. Resistant bacteria can spread from person to person, making it a public health concern. If antibiotics stop working, even simple infections can become dangerous. Hospitals and doctors are working hard to prevent resistance by prescribing antibiotics carefully and encouraging patients to finish their medication. Like all medicines, antibiotics can have side effects. Some people may experience stomach upset, diarrhea, or allergic reactions. It's important to tell your doctor if you have any side effects, especially if they're severe. Most side effects are mild and go away after you finish the medicine. Antivirals can also cause side effects, though they're usually mild. Some people may feel nausea, headache, or tiredness. Serious side effects are rare, but it's always important to let your doctor know if you feel unwell while taking any medication. The best way to avoid needing antibiotics or antivirals is to prevent infections in the first place. Good hygiene, hand washing, and vaccinations are all important steps. Staying healthy helps your body fight off germs before they can cause problems. Vaccines are a powerful tool in preventing viral infections. They help your immune system recognize and fight viruses before you get sick. While vaccines can't prevent every illness, they have greatly reduced diseases like measles, polio, and the flu. If you're feeling unwell and aren't sure if you need antibiotics or antivirals, it's always best to see a doctor. They can help diagnose your illness and recommend the right treatment. Never start or stop medication without medical advice. Misusing antibiotics or antivirals can lead to serious problems. Taking antibiotics for a viral infection won't help and can cause resistance. Similarly, using antivirals when they're not needed can have side effects and waste resources. Always use medications as prescribed. Did you know antibiotics are also used in agriculture? Farmers sometimes use them to keep animals healthy, but overuse can contribute to resistance. This is why there are strict rules about how antibiotics are used in food production. Antibiotic resistance is a global health issue. When bacteria become resistant, infections spread more easily and are harder to treat. International organizations are working together to monitor and control resistance, but everyone has a role to play by using medicines responsibly. Scientists are constantly working to develop new antibiotics and antivirals. As bacteria and viruses change, new medicines are needed to keep up. Research and innovation are key to staying ahead of resistant germs and emerging diseases. Your immune system is your body's natural defense against infections. Medicines like antibiotics and antivirals help, but your immune system does most of the work. Eating well, getting enough sleep, and managing stress all help keep your immune system strong. Some people turn to natural remedies for infections like herbal teas or supplements. While these can sometimes help with symptoms, they don't replace antibiotics or antivirals for serious infections. Always talk to your doctor before trying new treatments. Children are more vulnerable to infections and their bodies react differently to medicines. Doctors are careful when prescribing antibiotics or antivirals to kids, using the safest and most effective options. Parents should always follow dosing instructions closely. Older adults may have weaker immune systems and other health conditions that affect how they respond to antibiotics or antivirals. Doctors consider these factors when choosing treatments for elderly patients, aiming for the best balance of safety and effectiveness. Pregnant women must be especially careful with medications. Some antibiotics and antivirals are safe, while others are not recommended during pregnancy. Doctors weigh the risks and benefits before prescribing any medicine to expectant mothers. Traveling to new places can expose you to unfamiliar bacteria and viruses. It's important to take precautions like vaccinations and good hygiene to avoid getting sick. If you do become ill while traveling, seek medical advice before taking any medication. Some foods can interact with antibiotics, affecting how well they work. For example, dairy products can interfere with certain antibiotics. Always read the instructions and ask your doctor or pharmacist if you're unsure about food and medicine interactions. For antivirals to work best, they often need to be taken early in the course of an illness. For example, flu antivirals are most effective within the first 48 hours of symptoms. If you think you need an antiviral, see a doctor as soon as possible. It's important to finish all your prescribed antibiotics or antivirals even if you start feeling better. Stopping early can allow germs to survive and come back stronger. Always follow your doctor's instructions for the best results. Keep antibiotics and antivirals out of reach of children and store them as directed. Some medicines need to be kept in the fridge while others should be stored at room temperature. Never share your medication with others even if they have similar symptoms. Unused or expired antibiotics and antivirals should be disposed of properly. Don't flush them down the toilet or throw them in the trash. Many pharmacies offer safe disposal programs to protect the environment and prevent misuse. The cost and availability of antibiotics and antivirals can vary depending on where you live. Some medicines are covered by insurance while others may be expensive. Governments and organizations work to make essential medicines more accessible to everyone. There are many myths about antibiotics, like the idea that they can cure any infection or that it's okay to stop taking them once you feel better. These beliefs can be dangerous. Always follow your doctor's advice and use antibiotics only when necessary. Some people believe antivirals can cure all viral infections or that they're always necessary. In reality, many viral illnesses get better on their own and not all viruses have effective treatments. Antivirals are used only when truly needed. The future of antibiotics and antivirals is exciting with new discoveries on the horizon. Scientists are exploring new ways to fight infections, including using the body's own immune system and developing smarter medicines. Staying informed helps us all make better health choices. To sum up, antibiotics are powerful tools against bacterial infections. They must be used carefully to avoid resistance and side effects. Always take them as prescribed and never use them for viral illnesses. Responsible use keeps these medicines effective for everyone. Antivirals help control viral infections by stopping viruses from multiplying. They're used for specific illnesses and work best when started early. Not all viral infections need antivirals, so always follow your doctor's guidance. Remember, antibiotics and antivirals are different tools for different jobs. Using the right medicine for the right infection is essential for your health and for public safety. Always consult a healthcare professional if you're unsure about your treatment. Staying informed about antibiotics and antivirals helps you make better decisions for yourself and your family. Keep learning, ask questions, and always follow medical advice. Together, we can fight infections and keep these medicines working for future generations. Thank you for joining us on this journey through antibiotics and antivirals. Understanding the differences, proper use, and the importance of these medicines is crucial for everyone. By working together and using medications wisely, we can ensure a healthier future for all.